Welcome to House Calls, the podcast. With over 20 years of experience as an orthopedic surgeon and sports medicine physician, Dr. Hugh House, better known as Ty, is your trusted expert in healing chronic pain through diet and lifestyle. His mission? To help you live your best pain-free life. And then there's Matthew Waldron, the rugged indoorsman with over 40 years of experience as Ty's loyal friend. Matt's role? To keep Dr. House in check. On this episode, they talk to Stacey Fernandez, a personal trainer and fellow medical expert, as they explore new ways to improve your health and wellness. Let's get started.
All right, so the first podcast you're there. So the first this is perfectly appropriate because the first podcast of the new year is on experts. And our AV expert, our audiovisual expert, clearly doesn't know what he's
doing. We need a new expert.
He was out way too late.
He just woke up. It's 4:30 in the afternoon.
Today, we are rebranding Real House MD to House Calls to start the year.
House Calls, the podcast.
And
welcome.
Now moving on, Matt and I, you guys remember Matt from the first podcast, Living Sober. Matt's going to be my co-host. Today, we're talking about experts. So when I think about experts, I think about Stacey Fernandez. So here's why I started thinking about experts. There's a lot of stuff about experts, politics, sports medicine, and there's a little bit of experts are not always right. We always kind of believe that. So I thought that we would bring on two experts with different backgrounds to get to the level of expertise and have a discussion about experts. So Stacey's resume is that she is a mother of four, and everybody knows when it comes to medicine, everybody goes to the mom first.
Right.
Plus, she is a personal trainer, so she
Yep.
trains tons of people in her neighborhood, so she knows a lot about exercise, nutrition, that kind of stuff. Plus, she listens to a ton of podcasts.
This one?
Yes.
Sometimes.
Okay.
Yeah. She
Every
listens
now
to
and
a ton
again.
of podcasts, and what else? You watch the news, you do all that stuff.
You do it all.
So you are an expert, and you're practically a doctor.
Yes.
Okay. So me, I was pre-med. I went to college for 4 years to study medicine. I went to med school. I then did orthopedics at the University of Texas. I did hand surgery at the University of Louisville. The Academy of Orthopedic Surgery considers me an expert in orthopedic surgery. The state of Maryland considers me an expert in medicine. And I actually do some expert witness stuff, so the legal system considers me an expert, right? So that's my resume.
I'm going to need some definitions on those.
Is super competitive with me, so she considers herself that she knows more than me.
Can I say something?
Yes.
You're also super competitive with me because I feel like you want to be a personal trainer more than you want to be a doctor.
So like you want to be a doctor more than a personal trainer.
100%.
So
but I think I got the better end of the deal
I think you did
because
too.
I didn't have to go to as much schooling.
I forgot to mention that Stacey's my much older cousin. We probably need to
By about
to
a
say
year.
that. Yes, we need to say
But
that.
most
for
people,
everybody.
you need to say it because most people would think I was younger.
Yes, that's true.
They're both born in the 60s. This is
So
good at that.
the actual reason why I started thinking about the expert thing was I was watching the Ravens. Matt is not a Ravens fan. Stacey and I are a Ravens fan. Matt is a sad Redskin Commander fan.
Correct.
And the Ravens do this thing on fourth down when it's 4th and 1 or 3rd and 1, and they bring a tight end in to take the snap to do like that Philadelphia tush push kind of thing. And in my mind, I'm watching the game and I'm like, this is the dumbest thing ever. Because the tight end is not used to taking snaps. The offensive line is not used to his cadence. And I think he's going to fumble. They're going to be offside. Something's going to go wrong. And I'm like, this is dumb.
So wait, Ty, you're saying that the tight end who plays quarterback in this
scenario. And I'm like, it's just dumb. And at the beginning of the season, it never worked. Now it's starting to work. But the expert is Todd Monken. Wins 2 national championships at Georgia. He was actually great with the Cleveland Browns, and now obviously he's great with the Ravens. So clearly I'm like, I am missing something. There's something going on here. So I recognize that I am not an expert in this area, and even though it looks dumb to me, maybe it's not dumb. So that got me off on my tangent.
Okay.
All right, we can cut.
sense.
Hey, Carlos, cut a lot of that, please. Thanks.
So now we are getting into some medical scenarios. We're going to do this game show version.
Wait, let's just back up.
Okay.
Stacey, when it comes to you being an expert,
Yes.
okay, what got you into becoming an expert in personal training?
So I started when Nevi was going into her freshman
Sorry,
year.
people at home.
Yes.
I don't know what a Nevi is either. What's a Nevi?
My oldest daughter
Okay.
was going into high school and was training for the soccer team, trying out for the soccer team. So I decided I would take some of her friends from Sherwood and I would run a group exercise.
Got it.
And
Did you
then-
play soccer growing up?
No.
Okay.
It had nothing to do with soccer. It had everything to do with running. I was a runner.
Yes.
So I did that one summer, and then it took off not only with her friends, with some of my own peers.
Right.
So then I became certified as a personal trainer and went down the route, and now it's been about 17 years.
Got it. Great. All right, so you expert. I
Yeah.
got it. Okay, do you have any feelings about the Ravens and their tush push?
well-
I mean, what's your thought on that?
The tush push, I really don't have
Okay, all right.
anything to
So
say.
you're- so
but I
you're
will say I
level-headed.
think they're going to win the Super Bowl this year.
Fair enough.
That's-
Good. All right.
How about just your general in the world on experts? Do you just say, oh, they're an expert and you look at their credentials, or do you say they're an expert, but let me see what everybody else is saying?
I would not just take their word at face value. I would research. Even if they're an expert, I would make sure that there were a few other backups that were saying the same
Right.
thing.
Right. I
Yeah.
want to make sure that if they're calling themselves an expert, they've walked the walk, right? They've done it. They've run a lot. They've cut open hands or whatever it is you do. They've done it. They've actually done it before they say they're an expert.
So what I do is I post Instagram videos.
Yes, you do. I thought so. You're an influencer. I had no idea about this stuff.
Well, that's what he's trying to be,
Yeah.
but he didn't know he's a doctor.
Yeah, I had no idea. Doctor influencer. Okay.
So the issue with medicine is it gets a little bit tricky because there's a problem with people being Dr. Google, but then you also want people to, once you tell them what their diagnosis is and what the treatment options are, you want them to actually carefully consider it, and maybe if they have questions, at least research it enough so that they can ask you questions.
Right.
Now, you're risking turning a 5-minute patient visit into a 20-minute patient visit if they have too many questions. So there's balance, but you want the patient to be informed. And in reality, most of an office visit is teaching people about what their diagnosis is.
Right.
So when people just be like, oh, whatever, I don't care, do whatever you think is best, that's not really the doctor-patient relationship.
No, you want buy-in from the patient.
I like that.
Buy-in.
Yeah.
B-U-Y-I-N.
In.
So should we get going on our
Yeah.
patient scenarios?
Yeah.
Okay. So Matt is not a huge pickleball player. He's
That
a
is
big
correct.
golfer, but he plays pickleball all day one day. And then in the morning, 8 to 12, he's loving it. It's great. And then in the afternoon, all he does is he goes and he works on the House Calls podcast. So he's over a desk, like working on the podcast all day. The next morning, he wakes up and literally his back is killing him. He can't tie his shoes. He can't bend over. He can't do anything. He calls you. He's like, Stacey, you're the expert.
That's who he's
You
going to
know.
call.
That is who he would call. He's not going to call Clever.
Definitely not.
Yeah. So what are you going to tell him to do?
I'm going to tell him to stretch a little bit because I think after he played pickleball, he just sat right down on the computer in a very bad posture. So I want him to stretch out a little bit, and I want him to go out and play pickleball again.
That same day?
You know, the next day.
Okay.
You said it was the next day.
Okay.
You
Yeah,
sore
yeah,
the
You
next
did.
day.
You did.
Okay. Okay. Any like medicines?
No.
Okay.
He can get over it. He can take turmeric.
Okay.
Yeah.
What if he what is turmeric?
Turmeric is a spice.
Okay.
Anti-inflammatory.
Okay. Would you mind if he grabbed Tylenol, Motrin, Aleve, that kind of stuff?
I would not mind, but I would not suggest it because I would not want him to feel like that is just putting like a little Band-Aid and it's a bad habit to get into every little time that you're sore to just start popping the Motrin or the Advil. I don't think it's necessary.
So in this scenario, he literally can't even tie his shoes. Like he's in
Okay, then
pretty
I-
excruciating.
Jeez, from playing pickleball?
Yeah.
No, okay, in that case, I'd say sure, take 2 Motrin and call me in the morning.
Okay. So what about ice or heat?
I would say ice.
Okay.
But what part of it? His back?
It's his low back. Sorry.
His lower back, I would
low
put
back.
heat on
His
it.
lower back.
His
feels
lower
like
back, I
it's
would put
on
heat
fire.
on it. I would
Okay.
put a heating pad on it, 20 minutes on, 20 minutes off for an hour.
Okay. So if he called me, like say he calls Klep is busy, he calls Terry's busy, and he's desperate, and he calls me, which we all know I'd be his first call. This is what I would say, and I think you got an A+ on that actually. Explain to them is that most of us who are middle-aged, Matt's a little bit past middle age, have degenerative changes in our back. So we all have degenerative discs, we all have arthritis, most of us have a little bit of stenosis, which means the narrowing of where the nerves are. And we all have that. So that means that if we go do an activity, a physical activity that we're not used to, and then we sit all day long, and that's the thing, we're sitting at the computer. Sitting is the new smoking.
I thought sitting was. Okay. I thought sitting was the new smoking.
I said sitting
That
is the new
is. What
smoking.
did you think he said?
Pay attention. So sitting's the new smoking. So what happened was he used those muscles, he irritated the joints of his back, he irritated the discs of his back. That causes pain. Your body tries to protect itself by the muscles going to spasm. And the most important thing you said is do not just lie down in bed and be like, I'm sick, lie down in bed, I need a rest. So with backs, you need to start moving right away. You want to basically get the inflammation down. So turmeric is a great supplement to get the inflammation down. The best way to get the inflammation down is just give it time. Motrin or Advil, Aleve, those kind of medicines, as long as your stomach's good and your kidneys are good, is fine. But if you have any problems, then you shouldn't take those at all. And heat is better than ice for backs.
For
Well,
back.
that's what I was thinking. Knee. That's what at first.
And the reason is because backs, the stiffer they get, the worse they get, and ice stiffens you up. So although ice theoretically would control the inflammation, it's just going to make you stiffer.
What about people that use ice baths?
So if your routine is to do an ice bath every day, you'll pop in the bath and probably feel good. So it's not a hard no on ice at all. It's just that, then get moving.
Got it.
Like, so I would, if you're a routine ice bather and you can manipulate yourself into the bathtub, you'll get that dopamine hit. You'll feel energized. You'll pop out. Your back will be numb. You'll probably feel pretty good. So then if you went directly to like a heating pad and then started doing some gentle stretching, the gentle stretching was good also. That's important.
So, all right, let's run it back though real quick. Couple things. First off, in this scenario, you didn't mention that my wife and daughters would have to take care of me through every step of that. Okay,
Probably a
Stacey's-
little massage on the
Yeah,
back.
okay, all right, let's make sure we say that. Secondly,
Your wife and daughters would if it was Carlos Fernandez Sr. He's like one of those.
he was raised.
You don't get Motrin, get back up, start again.
He's very cool. And so in this scenario, we have two experts talking about it, and you are giving yourself the higher ranking expert because you're telling Stacey that her answer was correct. Is that my understanding?
So technically you're the referee, so
This is my other thing about the Motrin. I feel like so many people are so apt to just pop the Motrin.
Sure.
And I feel like if you do that when you just have like a one-day injury from pickleball, then you're going to do it the next time you have it. And I don't think Motrin, it loses its efficacy if you use it every day or every single time you have an injury, you're popping Motrin, or every single time you have a headache or you feel bad, you're popping Motrin. Then when you really need it, and I could be wrong on this, when you really need it, it doesn't work as quickly for you.
So I totally agree with you. I think as a society, we pop way too much Motrin, Advil, or Aleve, which is in the class of NSAIDs. The thing that I think happens is taking it for the minor aches and pains. Like, so I try never to take it, but like if I'm doing something big, like I'm going skiing, that second day, if I'm going to do better taking Motrin, I'll take Motrin. So that's like once a year.
Right.
Or if I'm super sick with maybe the flu or something or a fever, I might take some Tylenol, and that's a different subject. But I try to basically never take pills. But other people, like if you have a horrible knee arthritis, and it's either like take Motrin sometimes or get your knee replaced, then it's like the risks of Motrin, as long as your kidneys and your stomach are good, the risk of Motrin is less than the risk of the knee replacement. So it's like I don't have a hard, fast rule, but I do like it when people say, hey, I'm trying to take turmeric, and they try to avoid those medicines. And you're right, use it when you really need it.
So not to get to that point, I think for weekend warriors or whatever you want to call it, what's the best way to avoid having these pains? Stretching.
So stretching. So
Right.
and if you go to my blog on the Real House MD website,
See if I take that
there is a blog on pickleball,
Is
and
that why you get paid the big
it
bucks?
shows little videos on how to do the stretches. So that's a good point. So technically, especially once you're middle age or past middle age, you should stretch before, you should stretch after. And if you truly are like a middle-aged athlete, even adding like yoga poses. And you don't have to go do yoga for an hour and a half. Like, how much do you do yoga? You do it like an hour and a half at a time, right?
Correct.
But technically, you could probably get away with 10 minutes a couple times a week.
And also, when it comes to stretching, before you exercise, you should be doing dynamic stretching.
Right.
After you exercise, you can do static stretching. You should not do static stretching before you exercise.
And the difference between the two is?
Dynamic is you're moving, static you're staying still.
Got it.
Yeah.
And it all depends on how much pain you're in. So if you wake up and you're like, I can't tie my shoes, but then you move around, it loosens up a little bit. You don't need to take the Motrin. You could just, you don't even have to put the heating pad on. You could just start gently stretching. If you're like, oh, I did too much yesterday, and you lie on the couch and watch football all day, you will be miserable. It'll get worse the next day. So you should always do an active recovery. But in the situation where you're like, I cannot get out of bed, you need to get out of bed. So if you need to take Motrin, use the heating pad, take a bath with Epsom salts, do anything you can to get a little bit of motion in your back.
Okay.
And then the big thing is, when do you know that you should go to patient first? When should you go to the ER? When can you wait until, say, Monday, or wait until the next day to call the
Whatever
doctor?
Stacey says.
Right.
Yes.
Well, I call my acupuncturist first before I do anything else.
Well, there are some scenarios.
If I had a back, if it was something like that.
If you have a
muscular.
little bit of pain going into your
Yeah.
butt or down your leg,
Yeah.
that's sciatica. That's not an emergency. But if you are losing strength in your legs, if you're losing complete feeling, if you're losing control of your bowel or your bladder, you need to go to the emergency room. Not patient first,
Right.
not wait for the doctor.
Right.
I'm definitely not calling Stacey.
Those
Hey,
are-
I lost control
I'm
of
not
my house.
answering the phone. I'm not answering
Those
that
are
one.
very rare emergencies. But it's serious. Back pain is like the...
Stacey, this is so embarrassing, but I got it.
Did you not listen to Ty? He told you to immediately get to the ER.
But back
Why
pain
are you
is
calling?
so common. It's like
I
the
know.
number one reason to visit the doctor. So I'm glad we
Yeah.
started with back pain. All right, so now we are moving to a different part of the body. We're going to the shoulder. Okay, so this is Stacey's husband,
Okay. Otherwise known as Carlos.
Carlos. But we need to come up with different scenarios. But it is Carlos, but he has a different job. He's doing a lot of hammering
Yeah, that sounds like Carlos.
above his head, and he
He catches butterflies.
He then watches the Ravens win, and when he reaches back for a beer after hammering all day, or he reaches up to say touchdown, he literally can't lift his shoulder above his head. It is so
Frozen shoulder.
painful to move it.
Yeah.
Like, he can do this,
Yeah.
and if you forced it, he could get the whole way, but it's
Yeah.
incredibly painful.
Did you do shoulders today? Did you work on your shoulders?
What are you doing? What are you doing to treat that? And that is the number one reason why people come see the orthopedist.
For the
Shoulders?
shoulder injury?
Is for this diagnosis of shoulder. So what is you don't have to say the name of his diagnosis, because I'm less
it-
interested in
yeah.
you being like, this is the diagnosis. I'm more interested in what's your
Icing.
treatment. So what would you treat with?
Would you ice it?
I like that.
Okay.
Uh-huh.
And
You're the expert.
I know. Well, he's a doctor.
So you would ice it after the
not a
during the-
doctor.
You would ice it. You would ice it when the injury happens.
Right,
Okay.
acute.
And then
Yeah.
what would you start doing the next day?
I would just start slowly trying to move it up. I wouldn't go up and down right away. Correct?
Carlos loves to
You're the
raise the roof.
expert.
My understanding is he loves to raise the roof.
You're the expert.
I would try to start moving it
Okay.
a little bit.
Okay. And then what would you do for inflammation? Same as last time?
Same as last time.
Okay. Would you force him to drink whiskey to get a little bit more motion?
He would probably force himself to. I would say no
If you
to
put the
that.
turmeric in it.
Okay. What would you do?
I would not call Stacey. I would call Dr. Brian Klepper and ask him what to do, and he would tell you rub some dirt on it and get back out there.
Okay. So what do you think the diagnosis is?
Rest and ice.
No, that's the treatment. What do you think the diagnosis is?
Frozen shoulder?
No.
Okay.
What do you think it is?
I think it's a torn labrum.
Oh, interesting.
Or
So-
is it like a pinch nerve? Like from
So
going
what it
so much
is,
repetitive stuff?
It's basically called impingement syndrome, which is, or rotator cuff syndrome,
Yeah.
or shoulder bursitis. And what it is in your shoulder right here, you have your rotator cuff. And most of us in middle age have partial tears of a rotator cuff, tendonitis of a rotator cuff. A lot of people have degenerative labral tears. When you do a whole bunch of overhead stuff, you can irritate that, especially if you do a bunch of overhead stuff and then you get stiff and then you go do something. You can cause the rotator cuff to get inflamed. You can cause the bursal sac to get inflamed. So the most important thing is to keep it moving so that you don't down the road get a frozen shoulder. Frozen shoulders are a little bit different because they can happen spontaneously to people, especially more common in diabetics where their shoulder capsule just freezes up. So you're right, you don't need to go to the emergency room. You can just start it with early motion and anti-inflammatories if you need to. A lot of them will resolve. How many weeks would it take for it to bug you before you decide to go to a doctor?
Is this for her or for her husband? Like her
Right.
husband keeps
For her
complaining.
husband.
Right.
If her
He keeps
husband
complaining.
keeps complaining,
If
like,
it he keeps complaining, and
because
it's
Stacey's
been
Stacey's tougher.
2 weeks,
And is there a program you would put him on, or you would just say move your shoulder?
I would tell him. Yeah, I would tell him to. I would, because I feel like I'm
This is like
thinking.
Jeopardy.
So this is no, but I'm thinking of.
This isn't a spelling
I'm
test.
thinking of tendonitis. Like you're supposed to let it rest before you start like doing weights again. Like I wouldn't get him lifting weights right away again.
Let the inflammation
But
die
I would
down,
maybe
and-
I would maybe start with small weights, trying to
Yeah.
get over the head. But I wouldn't get right back to, let's say he's lifting 20 pounds over his head. I wouldn't go
Yeah.
back to 20 pounds.
So I think
would give
you're-
it a rest time,
Yeah.
and I would work back up to it. And if in a week, 2 weeks, there was still no improvement whatsoever, then I would go see a doctor.
So I agree, because you're kind of starting your therapy on your own, and trying to get your motion back quickly is the best thing. But you should hold off on weights until you're feeling better and recovered.
Right.
You're right. Long term though, if you want to prevent that being a problem, weights are the key. So it's rotator cuff strengthening exercises
So you do
will
these
make
instead.
you way more resistant
Right.
to that injury, and also stretching prevent it.
Do you do the overhead? If I had a rotator problem, I wouldn't go right to this to help it. I would go to this type of rotator.
So I would
To strengthen
you
it
want
this
to
way
get your
first.
full motion back. So you
Right.
do want to do this, you want to do this, you want to do this. You do want to get your full motion back quickly, but you're right, you don't need to add weights until it calms down.
Because this is going to hurt, and if you keep doing it with weights, you're just going to irritate. You're going to keep irritating it. But if you can do laterals to here, then I would be doing that, or
Now-
forwards.
Now here's your expertise. When would you get an MRI?
Oh gosh, after a month.
So here's the deal. None of us, I guarantee you,
I
none of
never-
us, given our age, have a normal MRI. of our
Right.
shoulder.
So never.
Yeah. No. So the point
That's
is,
why- that's the way-
the point is, we all could have partial
Yeah.
tears of our rotator cuff.
Yeah.
We all could have some tendonitis of our bicep. We probably all have degenerative labral tears. We probably all have some arthritis and some bone spurs, and we don't even know it. So if you hurt yourself and you get an MRI that day, you're going to think that your injury caused all that stuff, and that
Right,
stuff was
and
there the day
it's-
before
yeah,
you got
so
hurt.
yeah.
So when a surgeon orders an MRI, they are usually doing it as a preoperative test. So if you go to the doctor and he's like, you probably have a partial tear of your rotator cuff that you just irritated, or you have bursitis, they're going to send you to physical therapy. If you're miserable, they're going to give you a cortisone shot. So that all gets into how you feel about cortisone.
Right.
And you might be like, I want to avoid cortisone. But if cortisone is going to get you a head start on therapy, you might do it. When you get an MRI is if all that fails, or if you think the person has a full tear, tendon torn away from the bone. And that's where you get an MRI and you talk about what surgery would mean versus not what surgery wouldn't mean.
Okay, so again, it's a recap.
Okay.
You come in, so Stacey is the layperson.
Okay.
And Stacey, so far, in my feeling, has nailed every one of them.
Yes.
And then you come in as like, I got all these degrees. I'm an expert here, and law expert, Hollywood, everyone loves me, podcast influencer. And you smash her, right?
Yes.
And you say, yeah, you did well, but you got to do this also,
Yeah.
right? Okay, so as long as at the end of these conversations, you're winning, that's all that matters.
No. So far, what I see is the patient is lit, and Stacey hasn't wasted her time sending her friends or family to sit in the ER.
Okay.
And the
Right,
ER's
because
ER's
I
gonna-
never,
Yeah.
Yeah, and the ER's going to get an
Yeah.
X-ray and be like,
yeah.
go see your doctor in a
Right.
week or something.
Okay.
And it is true. Even experts disagree. So if two experts were discussing how to treat this, one shoulder expert would be like, I give everybody a cortisone shot because I want them to start moving their shoulder right away.
Right.
And the other expert would be like, I get an MRI of everybody because I'm worried they might have a full
Yeah.
tear. And those two experts will argue back and forth.
Because if you just get a cortisone shot, again, that's like putting a Band-Aid on it. If you have a full tear, if you have a full tear, you have a full tear. You have to get
Right, but
it
it's like the
repaired.
Advil.
But if you have a partial tear and you get a cortisone shot, and then you feel like you can do more, then you might make it worse.
Not really. So if you have, here's the this is so now we're getting complex.
Oh, you're cute. Not really. That was cute.
Yeah.
Let the dog
So actually, a lot of people live with full tears, and their other muscles just compensate for it, and they don't even know they have a full tear.
Yeah.
So, but if you have a full tear, you're more likely to maybe potentially need surgery. So you're less worried about the cortisone masking it. The cortisone is just going to calm it down. If you have real damage, it's just not going to last very long.
Yeah.
So
the help from the cortisone.
Yeah,
shot
you're not gonna really damage.
And you can only get 2 cortisone shots, right, in one particular case.
No, you get 3 cortisone shots per joint per year. Is
Per
kind
year?
of like
I thought it was
general rule. Like
try to stay away from all that.
yeah,
It's
you treat it naturally.
Yeah.
So I think right now though you're
You're a doctor right now.
You're a doctor right now. Yeah. So okay, the next one. You wake up in the middle of the night.
Yeah.
And you're literally having a dream that you've lost your arm and you cannot feel your arm. Your arm is dead, right?
Yeah.
You shake it away.
Yeah.
Your arm comes back and you're like, that was weird. Okay.
Yeah.
But then that starts happening like 3 times a week.
Oh my.
Okay. Are you doing anything? Are you worried about like you're waking up your arm, you just can't feel your hand and you're
Are
shaking
you sleeping on it? Like it's just.
You could be, but like it's happened. It's happened
like
3
a
times.
nerve problem.
It's happening like 3 times a week. Are you concerned?
3 times a week for how many weeks?
It's now going on like a month and a half.
Yeah, I'd be a little concerned.
Okay. So you schedule a doctor's appointment, but at that time now it's even starting to go numb like during the day. You're doing stuff and you're like, oh, my hand's going numb.
Yeah.
Or how are you treating it? Wow. Are you going to the ER? Are you going to the ER? Are you going to patient
No, I'm calling
first?
Ty and saying, Ty, my arm keeps falling asleep on me. What the heck happened?
Let's say you don't know somebody who's a doctor. Are you freaking out?
I would probably ask my doctor about that. I wouldn't be freaking out, but I think I would at least get on the portal and say, hey, this is what's going on.
Would you Google it yourself and be like,
Probably.
okay.
Yeah.
Okay. And what do you think you would come up with?
Some type of nerve.
Okay.
Some type of nerve.
And
something.
What's the most common nerve thing? You know what's funny? It's because this one is like one of the most common reasons why people come see me, but it's actually not really a sports injury. So since it's not the world in personal training, you're
nerve problem.
You're
Give
more
me a
struggling. You had it.
I know, I still do, actually. It just came back like 3 weeks ago.
Hold it. Give me a.
What would be the hint?
I had it.
Well, you stop walking with me, so I don't know your
I know,
injuries.
sorry.
It is a nerve
Not
wrist
intentional.
problem.
Carpal tunnel.
Yeah, carpal tunnel.
Okay.
So you're getting numbness in your
Oh
hand.
yeah, because I had it on my.
What is your first line of treatment? Like, what are you doing first, do you think?
Carpal tunnels, like hand exercise, getting those weights in your hand. Like my dad always did the grips.
Yes. Yeah. Okay.
What are you doing?
I'd
Squeezing the
also
Charmin
do-
over there? What are you doing?
I'd also do my TRX, his whole med health.
So technically, the first line of treatment of carpal tunnel syndrome, and I think this is funny because this has nothing to do with sports, so you're getting this question wrong, is to wear a splint at night. Because people have a tendency to sleep like this. It's the fetal position, and the nerve gets pinched off.
I think with me, I'd
And
sleep on it.
Then that gets numb and tingly. So some people
But
like
it's
sleep
a
on
simple
it.
little. You didn't get.
I haven't had the surgery yet. I want to, but I can't find a doctor to do it.
It is. So what you do is you wear the splint at night, and if that takes away your symptoms and you're good to go, then you're fine for a long time.
I actually had it in my feet.
Yeah.
I had it in both my feet.
Tarsal tunnel. So if you
and it's just the curling up the thing, it just needs to be released.
So your nerve gets pinched right here, and basically you wear the splint. If that resolves it, you're good to go. You put the splint in your drawer, and if it comes back a couple months later,
so you don't even need to be worried about it.
You don't need to do anything about it. But if it keeps coming back and it's even getting numb in the splint, and you're losing feeling in your fingers, then you need to be checked out. And basically, the best treatment for it is surgery.
Yeah.
So there's not a whole lot of medicines. Cortisone shots can help, but they're only temporary. So that would be like, I have a vacation coming up, or I can't get off work. But ultimately, that's a temporary fix. So you
need to release that nerve.
So that makes sense. So the nerve gets bent and it hurts.
Yeah.
What happens if you're doing you're holding your arms out like in a Warrior 2 pose and all of a sudden it gets numb?
Can you demonstrate a Warrior 2 pose?
Sure. No, but if you're like reaching like this or just keeping your hands above your head or something and it gets tingly.
So your nerves that come through your carpal tunnel, they come from your neck. So they originate in your neck, they go all the way to your fingertips. They can get pinched anywhere. So the most common is the carpal tunnel, the cubital tunnel, but you can also get pinched in your neck just from the degenerative disc and the arthritis. If you're pinched in more than one spot, that's called a double crush. There's also some stuff up here where you can get pinched that's very rare. So somebody who's middle-aged who might have a little bit of a pinch in the neck and they have more of a pinch in the carpal tunnel, you're always going to treat the carpal tunnel first because it's a much simpler, safer surgery than doing a neck surgery. And the neck, you really try to avoid surgery.
Right.
Like you're trying to do your stretches and that kind of stuff, which if you're doing your yoga and that happens, that's what's going on with you.
Got it.
Do you do acupuncture?
I do not.
You should.
I would like to.
So tell us about acupuncture.
Acupuncture is my savior.
Is it?
Yeah. When I started going to my acupuncturist probably 15 years ago, and it was when my knee exploded the first time.
Yeah.
And I was like, I can't walk. And I was like, I have to get a knee replacement. I have to do something. And I went to her. And I went to her twice a week for probably a month. And the inflammation went down. And I finally was able to start running again. And now anything, like if you have a pain in your back, I always go to her first because if it's a muscle related, that can just release the muscle. And sometimes if you feel it in your neck, if you hold all your stress up like here, like if you get just a few needles right here and they all relate, she'll put one in my toe for my neck and whatever, but it just releases everything. And it also it helps with anxiety or nerves or all of it just the way your whole body reacts with itself. Like if you're having a pain up here, like if she works all on your back, then you walk out of there and you just feel released.
So besides turmeric, do you do any other supplements for like when you're having it?
I feel like I probably
inflammation.
Do. For inflammation, no.
And do you do anything with nutrition for inflammation?
The food that I eat. Yeah, like blueberries are anti-inflammatory, avocados are anti-inflammatory, salmon's anti-inflammatory.
So if your knee's blown up, are you
more likely
up your
to
amount of those foods?
Not necessarily. I probably should, but
but it's just part of your regular.
Yeah, it's part of my regular diet anyway.
And then what foods do you think cause inflammation?
Like processed food.
So if you're hurt, will you be like no processed food, or you don't eat much anyway?
I don't really eat. Okay. Yeah, I try not to, and also sugar. That's the new, sitting's the new smoking, sugar's the new smoking. It's just.
So what about when people you're training have that just minor injury? So some of the stuff we talked about, like maybe bursitis in the shoulder, maybe low back pain. Yeah. Do you ever tell them, I know you tell them to take turmeric because they all tell me that you take turmeric. But do you tell them to do anything?
They're like, I said yes because Stacey scares me, but should I be doing that?
Yeah, exactly.
So do you tell them to do anything else?
If they have a minor injury, depends what it is. I tell them not to, no pain, no gain is not really a thing. I feel like if you're injured, give that portion of your body. If your arm's injured, your shoulders, listen to it. Listen to your body always, but then kind of get back on the horse, get back to it.
So because exercise is such a habit, what do you do you tell them okay, your shoulders hurt, make sure you're using the other parts of your body. If your knees hurt, make sure you get in the pool or something like that. Yeah.
Keep moving. Body in motion stays in motion. Body at rest stays at rest.
So with the people who stick with the personal training versus the people who come for a week and stop.
Yeah.
Do you notice
100%.
But
injuries.
What are not just injuries, but what is the biggest obstacle to getting people to work out every day? This is intermission from our test. We're moving into lower body next, but this is what. No,
I say to everybody, I think the number one thing, especially when people come to me new and say, I'd love for you to train me, can we get into a schedule? And I said, if I have time, I absolutely would love to do it, but you have to promise me because I will promise you that I will be consistent. You have to be consistent too. Now I understand that vacations happen, people get sick, things happen, but the key is to do it and to try to stick with it every day. And it's like, I always say, it's like brushing your teeth. Like, you wake up, you brush your teeth. You wake up, you do some form of exercise, or whenever you can do it during the day, but just be consistent about it. If when you start exercising, you say 7 days a week, I can't commit, because then you're going to fail. But I could commit to 2 days a week. So the first few weeks, say, give me 2 days a week. Give me 2 days a week where you're going to go out and you're going to do something. You decide what you're going to do. And then after a month, I want you to give me 3 days. So I think you have to build it up slowly, and the people have to be consistent with it. And you can't beat yourself up. Let's say you're supposed to be doing 3 days a week and you do 2. That's okay. Next week, get back to 3.
So what are the things, like the people who become like they don't exercise, or maybe they used to exercise, they don't anymore, and they come to you, is there any consistencies in the people who become lifelong exercisers? So the people who are not only working with you, but are like, okay, I'm walking 4 days a week.
Yeah. I think the hardest part, obviously, is when you start. Sure. And you hit a point after you've been doing it because you got to get over that hump. It might be a month, it might be 2 months, it might be 3 months. But once you get over that hump and you realize how much better you feel when you actually are doing it every day and doing it consistently, then you actually want to go do it and you want to do more. And
I'm sorry, but how long has this been an addiction for you?
Forever.
I mean, really.
Yeah. I started running with my dad when I was in 6th grade.
Okay.
Yeah.
We've seen your dad run.
Yeah. I know. We used to run the same pace. I used to run with Jerry Lee too. Jerry Lee, my dad.
Jerry Lee. Yeah.
He was a marathon runner.
Yeah.
And we would run up Main Pier Hill, and he would say, this is the deal when you run up a hill. You just look at your feet the whole time, don't ever look up. And whenever I run up a hill, I think of Jerry Lee, and I think you just gotta look at your feet, don't look up at the high hill.
But don't you find that funny that with a lot of stuff it's all mental?
Oh, it's
all mental. Like when I run hills and marathons, I think of a ski rope and just use my arms. I don't even look at my feet. I'm just doing that, and that gets me up the hill. Yeah. But it's all mental. So age 6. So even
sixth grade.
6th grade. Okay.
Yeah. And I always played sports.
Yes.
So, yeah.
Yeah. But when did it, like, even in college?
Yeah.
I mean, it was a part of your.
Oh yeah.
Yeah.
Yeah. That was the aerobics.
Yeah.
Yeah.
I just remember that, you and the leg warmers.
So to review a little bit though, I do want to stick up for her dad, because her dad was a slow runner
but he was consistent.
But he was consistent, and now he still walks or runs. He calls it running every single day. And the funny thing is, he chooses the hottest and coldest time of the day.
Yes.
And he does push-ups in between, and he's now 82
and
years
sit-ups,
old.
and he's done that.
Yeah. So
forever.
So like if you think about like an event or a kid's sports game, like in a stadium at 82, he's still climbing the stadium steps like it's nothing. And Stacey's mom is the same way, because they both have consistently exercised. So the people when they were 40 who were kind of teasing them for being slow, a lot of them are struggling getting out of a chair.
So Stacey, for you, how much of, and it's probably hard to quantify it, but how much of your love of exercising is because you saw your parents be so consistent at it, do you think? Do you think that, not that they ever said you have to run every day?
Right, no, not at all.
They weren't like that. That was your dad.
Yeah.
But no,
that was... my dad. I just like to, my dad would go out for a run, and I'd be like,
your siblings are all very disciplined for that.
Yeah.
So do you think it's all because of the role models that you guys had?
I think,
And then you found out you liked it? And
I think so. Because I think kids, they follow what their parents do.
Sure.
Yeah. Except for Carl's.
Yeah.
So you started off training young people. Have you noticed, like, the people who play sports, they're training for their sport, the ones who then make exercise a lifelong thing, versus the ones who they stop playing, they take off the cleats or the shoes.
And then they just stop. There's a lot of people.
Yeah, there's a lot of people like that. So
first of all, they get burnt out, I feel like, with the way people play sports these days.
Yeah, one sport year round.
Right, one sport, 365 days a year, they never get a break. So once that sport's done, they take it off and they're like, not doing that anymore. And then some people take it off and be like, I'm not doing that anymore, but I'm not gonna not stay in shape. Like, I think of like Nev's playing college sport.
Is Nev your only child?
Yeah.
Okay, just sorry.
Well, Lexi And well, Neek says, well, you've seen our push-ups.
So let's talk about this. So first of all, we got Nevi, who played college lacrosse with Hopkins and still runs and works out a ton.
Yeah.
With all those braces?
And did a marathon.
Yeah.
And then we have Nikki, who's very active and walks
Very
Sailor the dog a lot.
And
She
plus,
does run sometimes.
She does run, and she also was telling me, because of her job, she probably gets 15,000 steps a
easily.
day.
Yeah.
And what she has to do, she has to lift up these men or women who are like 200 pounds. So she's constantly in motion.
She's an occupational therapist, and we tried to hire her, but she said no.
Okay.
Yeah, I think it's because she doesn't like clever. But anyway.
She wanted to start in the hospital. She's going to want to come over soon.
Then Lexi is a marathon runner.
Yeah, she is. She's in New York.
Yeah.
Yes.
And then Carlos is still in college, and he's an avid golfer.
Yes, he is.
And
in a golf cart.
No, he's walking now.
But as a bet, he did run / walk a marathon. One of these, I bet you can't do a marathon tomorrow. And this was at 3 a.m, and he woke up at 7 a.m.
And they did it.
Ran a marathon.
And I just happened to call him when he was walking in the door after doing his 6-hour marathon. I'm like, what is going on? Because he's breathing hard. I just did a marathon. I'm like, what? He goes, Big John just did a marathon. He bet me I couldn't do it.
So the funny thing about that is, obviously, when you do a marathon, part of the marathon is the marathon training
That's
and
a whole
trying
part
to get
of it.
under a certain time and that kind of stuff. But there's a lot of people in the world, if you said, I want you to walk 10 miles, they wouldn't be able to walk 10 miles, or they would have to train to walk 10 miles. So obviously he's an active kid if he just hiked 26 miles. So it is pretty cool that something that he did it as a joke and he was still able to do it. So,
and it wasn't bad. Like, I think it was like a little under 6 hours.
So I used to, when you were doing marathons and you were having these great times and being one of the top amateurs in your age group, and I would always check the times and be like, oh, she crushed Oprah. She beat Oprah by an hour, or like she beat Jennifer Lopez. She beat, whoever it was.
Oprah, I thought she was going to beat me.
But sometimes you see these people and you look at the celebrities and you look at the marathon times, and somebody who doesn't seem that amazing does it in 3 hours and 40 minutes.
Oh, it's amazing when people pass you and you're like...
But they're all shapes and sizes.
Yeah, that's what I mean.
Find. That's what I find inspiring about any
actually,
5K or marathon.
Yeah,
cool.
Agreed. Yeah.
So when you stopped doing marathons because you were having some knee problems. So how did you then make the transition to what you're doing now, go into what you're doing now, but also I feel like I have a lot of patients who are having a lot of health problems. They're like, oh, I used to run marathons, but I got hurt 15 years ago. So how did you make that transition?
I think...
And I'm sorry, and what is your transition now? What do you do now?
I do a lot more resistance training, weight training, and I still run, but 3 to 4 miles.
How many times a week?
Probably 3 to 4 times a week. And I do the TRX, which is cardio and resistance training. I was going to say something, I just lost my train of thought. Being a woman, over a certain age, the muscle mass that we lose on a yearly basis, I just started to read so much more about weight training and resistance training and how that is the key for keeping your muscle mass, helping with osteoporosis, the beginning of osteoporosis, whatever. What's that called? Osteopenia.
Yeah.
So,
which
is
totally,
because you're 37?
Right, no, 39.
39, sorry.
So which is she meant to say 57, I think. 57. Is that right?
I am. No, am I 58? 57? What am I?
You're 57.
I'm 57.
We'll cut
Because I'm 55. Oh yeah, you're 57.
Yeah, I'm 57.
Okay. So sorry.
This is on the next edition of the Golden Girls. This is great.
So that is so true, is that we have a tendency to forget about strength training, especially as middle age. And that's one of my big things with house calls, with the website, is we have a tendency when somebody has health problems, high blood pressure, pre-diabetic, weight problems, but as the medical community to say, you need to go exercise. And a lot of people think that means go
for a run.
3 miles at a 10-minute mile pace. And it's miserable if you're not a runner. But strength training is probably the most important thing we can do. And ultimately, you need your leg strength to get out of a chair. You need upper body
It's
strength.
all functional.
Yeah.
Everything is so you fall on the ground, you want to be able to get up.
Yeah.
You want to be able to use your arms to push yourself up. So you got to have tricep. All that. It's all about
and it's probably
being
the best
able
way
to keep living.
If you are worried about weight, it's the best way to burn calories.
Yes.
And a lot of the strength training now is based on agility, so it helps a lot with agility. And if you're trying to control your weight,
right,
it's good.
And doing the side to side, like the TRX, it's not, if you're running, you're only using your quads, you're only moving forward. But if you're doing other types of exercises, like the TRX, there's a lot of lateral movement. So you're strengthening everything around the quads, not just the quads.
And the age group 20 years from us and 30 years from us, they worry about fractures, insufficiency fractures. So that's like hip fractures, where it's not trauma, it's just your hip gives out from a minor fall, or it can actually break before you fall. And weight training builds up your bone strength.
Right.
So that's what you're talking about, the osteopenia and the osteoporosis.
Right.
So with your clients, I always tell people that you can't out-train a bad diet. You stay away from diet nutrition. How do you
stay
handle
away
that?
from it. I have one certification in precision nutrition, but I also feel like as a personal trainer, you really shouldn't. I'm not a nutritionist, even though I know a lot about nutrition. It's not really. When I talk to people about nutrition, it's more about just talking to them about what I do. It's not telling them this is what you should be doing, because I feel like I'm not really, as much as I pretend that I know I know everything, I don't. So I think that they should talk
So
to
this
someone.
gets a little bit into the expert thing though.
Yeah.
It's like, do you need a certification to know that, that if you're doing strength training, you probably need a little more protein.
Yeah.
You know if somebody's overweight, they might be eating too much sugar or processed carbs. So you know these things inherently. Do you ever encourage them to see a nutritionist, or do you say consider it, or you should have these meals before you work out, or this is a good recovery meal, anything like that?
A little. I mean, we definitely talk about food. I don't think I've ever told anybody to go see a nutritionist. But there's just so much out there when you talk about Dr. Googles. There's just so much good information, and there's so many great doctors podcasts that talk about nutrition, and they're all consistent. They all say the same thing. So if I might say, listen to this podcast, because it's a doctor talking about maybe what we had just talked about, why you should be eating more protein, or why you should be cutting out all the processed food and the sugar and what it's doing to your body. Listen to this person who's telling you to do it, because they are an expert. And I think, do you need the certificate? Probably not. But I think to get the credibility, you have to have it.
Yeah.
If I was a personal trainer and just said I'm a personal trainer, but didn't do the reading of the books, I didn't learn. I mean, I learned from there, but what I learned from more is just doing and watching and knowing the right form. And that's just from years of doing it. Did I necessarily get it from the textbook? No. But if I didn't do the textbook, then I really couldn't call myself a personal trainer.
Right.
So I think I think one of the problems with people our age is that there was so much misinformation when we were growing up.
Yes.
Like, don't eat eggs.
Yes.
Don't eat meat.
Right.
And
it changes now.
Sure.
Yeah, it does change now, but at least now they're pretty much like, don't eat sugar, don't eat processed carbs.
Yeah.
I pretty much agree with that. Or don't everything in
Process.
moderation.
Right.
Have birthday cake.
Right. Exactly.
But it just don't make processed carbs and sugar 90% of your diet. So we can all agree with that. But I think the problem is, I think you have a lot of people who just gave up because they took all the wrong information. So they thought they had to starve themselves. They thought they had to be a vegan.
And some people are still in that mindset.
And they thought they had to be a runner.
Yeah.
And when they weren't going to do that, then they just went standard American diet.
Yeah.
I'm not going to exercise at all. And you want to reach that group to be like, hey, there's so many different ways. If you hate running, that's fine. You can do
that's what I
training,
always say.
strength
Find what
training,
you love and stick to
or
it.
you can do hot yoga with Matt.
Yes.
And if you saw Matt with his shirt off, watch the first podcast with Matt shirt off. Every middle-aged woman in America is going to want to do his yoga class. Can we get sponsored?
We should. Still know you're recording.
I think one thing I've written about is that when you're talking about nutrition or health or exercise, you really got to pick your spot. There is a balance between honesty and cruelty.
Yeah.
And in the office, when somebody's coming to see me because they fell and they broke their ankle, and you're looking at them, anybody can break their ankle. All of us could break our ankle.
Yeah.
But sometimes if they're 50 pounds overweight and you hear the story, you're like, oh.
What about somebody that breaks their ankle dancing to
But sometimes you're it's lack of agility, and it's the extra weight that probably broke the ankle. That's not the time to be like, hey, have you considered
cutting back on the
cutting back on the sugar kind of thing.
Yes.
Yes.
What the hell am I supposed to answer that? No, I'm not a doctor. I'm not an expert in anything. But yeah, I agree.
Why is he here?
You invited him.
I was here to watch football and eat. I have no idea what's going on. Stacey and I were eating TRX.
I've not offered you food.
Yeah, I know. The
football.
drinks are great. Parched.
So what are the ages of the people you train now? And how do you handle it differently for, say, like a 20-year-old versus a...
So yeah, probably from about 20 to 70. That's about the ages. The younger people like to do more of like the boot campy stuff. They want to do more of the cardio, and then TRX is just a range. I mean, 20 to 70. There's just so many options.
And how do you do like what's your typical TRX class?
Like how is it structured?
How's it structured, but also for people who don't know what TRX, how it works, like
So
with bands.
I feel like the way I do TRX, I think of it like a flow. Like if you did a yoga flow, it just keeps you're moving the whole time.
Building on it, yeah.
It's not like resistance training or weight training when you do a certain amount of reps, stop, do it again, stop. When I do a TRX class, I go from one move to the other, to the other, to the other, to the other. It's just all constantly moving. And about halfway through, maybe take a break and use resistance bands. I just change it up every time.
So is it
Use
like
other
a
type of equipment.
is it like a dumbbell class, like you would, or
No.
like is
People
it?
in there are
So
not
I guess
dumb.
what are you
Yeah.
doing? Chest presses and
No.
shoulder presses and squats.
Yes,
or
but
how does
I'm
it
doing
work?
that all together. Like, if I did, you should do a TRX
I should
class.
do a
You
TRX
both should do a
class.
TRX class with me.
I'd love to. Yeah, I would do it.
Because you would understand it. You just do a lot. Like I work
But
on
he
legs
does have
a
a bad
lot.
shoulder and carpal tunnel apparently.
Well,
I'll prepare. I'll
it'll
stretch
be
you for
fine.
Sign waivers.
It'll be
Sign
fine.
waivers.
Yeah.
I'll stretch.
You just move. Like I'll do single leg squats. So you're working your quads, and then you might hold that single leg and do biceps while you're standing on the single leg. You might go over and do a side lunge, work your abductors. You might do a curtsy, a dive, like working your hamstrings. So it just kind of all flows into it. I just change it up every week. I just go from different.
And you can do it inside, outside.
Yeah, I got a place downstairs.
Okay. Okay.
This is
That's
good.
our next. That's our next one. We'll do it together.
Yeah, this is our podcast studio now.
Yes.
She doesn't know
Yeah.
that. This is it.
Yeah. Do we have to worry about Rudy barking?
No.
Okay.
Nah.
Okay.
She gets used to. Look at her.
So, all right. So my feeling then is, because of your background, you are awarded the honor of being an expert in health and things, everything related to that. He has the medical degree, but he's an expert. So I'm gonna have to call this a tie, not a tie. But you both did
Not
very
not
well.
time.
No, I think you both did very well, and I wouldn't go see either one of you